My name is Mamadou Samba, and thank you so much for the invitation, Pat and Mr. Harris, Sinclair, and all of the friends that are here. Um, so some of the things that I will talk about has already been mentioned in terms of 7.2 million in healthcare professionals currently, and about 12.9 million by 2035. And obviously, we don't need to go further to understand the implication of this shortage in terms of the existence of care in the first place, accessibility to care, the cost, how effective the service delivery will be, and ultimately the outcomes of care that is sought out by these individuals. And so, in certain areas, not in certain areas, but thresholds have been identified, right? And these thresholds are not sort of points to which we should judge the health delivery, but thresholds. In other words, if you want to deliver 80% of care in health, there's certain threshold that you must have, threshold that must exist. And these are 22.8 midwives over 10,000 people, 34.5 nurses over 10,000, and 59 physicians over 10,000. And so this is not these are not a requirement, but these are in order for any particular jurisdiction or city or town to deliver 80% of health, they have to meet these thresholds, right? And so the reason for these shortages are somewhat similar to reasons why there are other shortages in different sectors, for example, in the public sector or other areas. And so in health, there's obviously a growing world population, which comes with its own set of health challenges, health demands, and health needs that must be met. There's also the fact that there's a growing, an aging workforce that is leaving the field, and not enough millennials or not enough young people willing to step up in those fields, and that are willing to, follow technology, get a job in technology or in other areas rather than being in the health sector. In developing countries, about 40% of the baby boomers or the aging population will leave the field over the next 10 years, which means that the younger generation, people like us, in order for us to, unless we step up in this field, we will continue to have a shortage of workforce in the health sector. And so there's also a lack of incentives for people to step up, because now going to medical school is very expensive. And so you come out, you owe $1 million. And so who want to do that, right? So the thing is, well, I don't want to spend the rest of my life trying to pay my student debt. So let me just go ahead and get an education that is cheaper for me in order for me to survive and not be in debt. And there's also an inadequate alignment of skills, training to meet the demands of the health sector. But particularly in the African continent, which is what I wanted to focus on a little bit more. In 2006, the WHO has identified 57 countries that is facing critical shortage in the health workforce. And of these 57 countries, 36 countries are from the African continent. And keep in mind that there are only 54 African countries. 36 of them are facing critical shortage in workforce development. And the African continent is only about 3 to 4% of the global health workforce facing critical shortage, right? You mentioned earlier that 6 million shortage, I believe, in the African continent, right? Which we only spend about 1% of the global health expenditures. Obviously, again, these have their own set of consequences. One of them is the life expectancy. The average African lives 14 years less than the average European, as a result, due to several factors, including the quality of care that we're getting, right? And so other factors that also are included in this is you have, in a lot of African countries, you have the public health ministry that are in charge of recruiting and staffing healthcare facilities. For the most part, they only focus on recruiting for the public sector. They don't do a good job of recruiting or helping recruit for private practitioners and working in areas that most people don't want to work in. If you go to the average African country, most health investment is focused on just the capital area. Outside of the capital area, if you want to access these facilities, let's not even talk about the healthcare. Let's talk about accessing the healthcare in the first place, right? You wake up in a typical town, the town that I live, we actually happen to have the only doctor in the town rented an apartment in my father's, in our house. And so on any given night, somebody is sick, they come and knock on my parents' door to get them to wake up and open up the clinic so I can get care, right? And so aside from that, the infrastructure that will allow us to access care in the first place is less than adequate. The roads, the bridges, the transportation system that will allow a woman who's getting ready to give birth to get to the facility safely in order to deliver a child. These are deficient and need to be addressed, right? There's also a lack of these regulatory agencies that regulate healthcare professionals. How do we know when somebody is qualified enough to deliver care? How do we know that, right? Do you just need to go take a certification course and get a certificate and say, now you're qualified, go ahead and deliver a vaccine to somebody? How do we know those things in some of these regions that we're talking about? And how do we measure success? How do we measure failure? And so you see a lack of regulation in terms of the health workforce and in terms of healthcare delivery, right? There's also a lack of, in my opinion, and also being confirmed by experts, a lack of, as I mentioned earlier, linkages for education, training, and workforce improvement of healthcare workers. In other words, if you look at the 47 countries that make up the sub-Saharan African countries, there are only 168 medical schools for entire continent, 168 medical schools, which means less people are able to be trained to be doctors or nurses or physicians, right? 11 of those have no medical schools at all, which means their residents have to leave the country to go to neighboring countries or immigrate to the United States or other countries in order to pursue an education there. And 24 of them have 24 of those countries have only one medical school. And so you start to get an idea about not only the shortage of workforce, but the shortage of places where people can go and be trained and sort of be experts or become physicians in order to go back to their communities and practice. You see these things in the African country because poverty is at its highest. And so as long as people live in these poor neighborhoods where there's no clinics, obviously they won't be able to get any care, right? And so if you look at, and I'll end with this, if you look at areas that were affected by Ebola, I heard Ebola be mentioned a few times this morning, even before coming out, listening to the live streaming. If you look at, for example, Liberia, right? A country that has roughly 4.1 million areas affected by Ebola. You compare to Croatia, which has similar number of residents. The density per doctor is 0.1 in Liberia versus Croatia, which had 28.4. Now you can start to see the difference between the quality of care and the existence. You take a country like Sierra Leone, another country affected by the Ebola crisis, right? 136 doctors, absolute number of doctors. You compare that to Denmark, your country, right? 18,000. You can start to see the differences. They invest a lot more in health infrastructure, training, development, and we are yet, because a lot of these countries just gained independence 50 years ago, and some of these are still struggling to find the path, right? And so, let me just stop there. I know there'll be a lot more questions, and then I look forward to answering some of your questions. Thank you so much.
Okay, thank you.